People are worried about the future of democracy. They're worried about authoritarianism, fascism. They're worried about, climate. They're worried about the local economy. Man, I'm gonna tell you something, and you know this, Dr. Lyerly, because you are with patients all the time. If you don't have health, nothing else matters.
Hello and welcome to the Dr. Kristen Lyerly Show. I am Dr. Kristen Lyerly, and I am here to tell you that healthcare in Wisconsin and all across this country is in crisis, and it didn't happen by accident. Over 275,000 Wisconsinites, that's enough to fill Lambeau Field 3.5 times. It's a lot. They're on track to lose their coverage, and premiums have more than doubled overnight. Hospitals are closing in some of the most vulnerable communities across the state, across the country. And the people who are doing this, the Trump regime, the Republicans who passed H.R. 1, they're calling it a success. Clearly it isn't, not if you're feeling it. So today I'm joined by two people who have been fighting back and holding the line. Brad Woodhouse is the president of Protect Our Care, the organization that is working with another organization that just released a report that we're digging into today called Healthcare in Crisis. Trump and the Republicans are making healthcare unaffordable for Wisconsinites. Brad has spent decades in the trenches of Democratic politics and healthcare advocacy, and he does not pull punches. And I have invited him to not pull punches today. So hopefully we'll have a fun and spicy conversation. And of course, there is fan favorite Joe Zepecki, one of Wisconsin's sharpest political strategists. He's joining us as well. He knows this state, he knows these communities, and he knows exactly what these numbers mean for real Wisconsinites. So gentlemen, welcome. Let's get into it.
Thank you, Dr. Lyerly. Woo! Let's do it.
Let's do it.
When do I earn the returning champion moniker?
Returning champion of what?
I don't know.
You're my champion, Joe. You always have been.
We'll
go.
We'll work on your moniker, and by the end, maybe we'll have a good nickname for you. Although you've got a pretty good nickname to be. I mean, Jay-Z. Come on.
It's not bad.
Pretty good.
All right, let's start talking about the topic at hand. Brad, Protect Our Care and DAA published this report, Healthcare in Crisis. Before we get into the Wisconsin-specific numbers, and I mentioned a few of them earlier, I want to ask you point blank, in all of your years fighting for healthcare in this country, have you ever seen anything this deliberately destructive?
I have never seen anything like this. Part of the reason is that we were successful in stopping the repeal of the Affordable Care Act in 2017. So, I mean, a lot of people think about that. 2017, they tried to repeal the Affordable Care Act. We stopped it. We got those votes in the Senate to stop it. And then we went on and we had a health care election, despite the fact that they didn't repeal the Affordable Care Act. The 2018 election, particularly in the House, was all about health care. It was all about the threat of a possible repeal should it resurface and what that would mean for pre-existing conditions. That was the dominant issue. You fast forward to now, and they actually got a lot of it done. I mean, if, they failed before, and we still had a health care election the next year. Here, they cut $1 trillion out of Medicaid and the Affordable Care Act in H.R. 1, what we call the big, ugly fucking bill. And then they turned around and they took away the tax credits. The ACA tax credits were helping people get insurance on the exchange. And so those two combined have created a healthcare crisis. And you might say, well, what happened? Did we go to nuclear war? I mean, was there a good reason to take all this money away from healthcare? No, we didn't have a calamity. We didn't have a nuclear war. What we had was Donald Trump and Republicans wanted to make permanent the tax cuts that he passed in 2018. They wanted to make them permanent and forever, and they needed money to do it. So they cut $1 trillion out of the Affordable Care Act and Medicaid, and they gave that to Jeff Bezos, to Elon Musk, and to other millionaires and other billionaires. And it was almost dollar for dollar. I mean, if you look at the tax cuts that went to the wealthiest Americans that they made permanent, it was about $1.4 trillion. The Medicaid cuts, along with cuts to the Affordable Care Act, are $1 trillion. It almost paid for all of the tax cuts for the rich Americans. So when your premiums are going up, when your rural hospital is closing, when you're dropping coverage, when people are getting, in a few years, when people are getting kicked out of nursing homes, it wasn't because we went to nuclear war. It was because these motherfuckers decided that tax breaks for the wealthiest Americans were more important than your health care.
I want to give one example of what that looks like. I mean, right? $1 trillion is such a big number, you can't get your head around it. So let's just take one of the guys that Brad just named, Mr. Jeff Bezos of Amazon. In 2025, Amazon paid $1.2 billion in federal taxes. The year before that, in 2024, before the big ugly bill went through, they paid $9 billion in federal taxes. That's an 87% giveaway. It's not because their business struggled. Their profits went up 45% between 2024 and 2025. But Republicans in Washington, every single member of Congress from Wisconsin who's a Republican, I'm looking at you, Derek Van Orden, Brian Stile, Glenn Grothman, the whole lot of them. And Tom Tiffany, now seeking a bigger and better job, after voting to give Jeff Bezos himself through Amazon a, what is it, $7.8 billion tax break. And they're paying for it by making it harder for people right here in Wisconsin to access healthcare, to afford healthcare if they are fortunate enough to get it. They have created this full-blown crisis because they chose to do their buddy Jeff Bezos a solid, and the consequences be damned.
In a nutshell, I hear you both saying that these Republicans have taken our healthcare away to give tax breaks to wealthy corporations. It's easy. It's just as simple as that.
It's individuals and wealthy corporations. And, you know, I mean, and then they decry the healthcare crisis, right? I mean, so they're pointing fingers. They say, well, it's the insurance company's fault. It's the pharmaceutical company's fault. It's the fault of the PBMs. It's the fault of the hospitals. And they're doing all that because they realize that they put themselves in a political bind. I mean, you know, when they passed, we're about a 1 year anniversary. If you can believe this, they signed this bill on the 4th of July last year. And so we have that anniversary, you know, coming back up. Then they went out in August of last year and they tried to sell it to the American people and it fell flat. You know, they tried to sell the Medicaid cuts where we're trying to get rid of fraud and we're trying to get rid of deadbeats, and no one believed them. And to this day, no one believes them. So they're trying to blame other factors. They're trying to change the subject. But I tell you what, if Joe and I have our way, 2026 is going to look like 2018. This is going to be a healthcare election. It's going to cost Republicans.
I feel it. As a doctor, I feel like this is the healthcare election. And usually I'm pretty focused on repro, but it is so much bigger than that because everybody is hurting. And we'll get into the numbers with regards to people in nursing homes and pregnant moms and kids, the people who Medicaid is covering. But Joe, I want to go to you because you get Wisconsin politics. You know Wisconsin like nobody else. What does this actually mean for the average Wisconsinite? How is this affecting people in our communities around the state?
Well, people know that they have to prioritize their own health and the health of their families. So it leads to a cascading series of terrible choices. I talked to a family from Northeast Wisconsin recently. Mom is a Navy veteran. Mom and dad together started a marketing business. They help folks in car washes, right? Mm-hmm. And so the component makers is a B2B marketing business. So because they're entrepreneurs and they didn't have a big enough company to have, you know, employer sponsored coverage, dad and the kids were in the exchange. This has been a tough year for them, tough last year, because a lot of their clients were Canadian companies who were making these parts, these component parts for car washes that they were then selling to American, you know, companies. Well, Canadians said, we want to stop doing business with America as a result of what Trump said about Canada becoming the 51st state and all the tariffs and the trade war. So their business took a hit because Trump ran his mouth. They had to go run the numbers, and they were looking at, well, because mom can get health care from the VA, and we got to have the kids covered, maybe we'll just cover the kids in the exchange and take a flyer on dad.
Oh, wow.
So God forbid if he has an accident, if he's out cleaning the gutters, if he's playing with the kids, a traffic accident that's not his fault, now he's not covered. But those are the kinds of real life decisions that are impacting people in Wisconsin who are trying to raise their kids, trying to run a business. They do have employees. They just don't have so many that group employer healthcare plan makes sense yet.
Right.
This is who we should be doing whatever we can for to empower to grow their business, to make sure their kids are successful. And now they're living with a black cloud over their head.
Right.
I got to tell you, this is such a common story. I mean, we have heard this from story, and we have thousands and thousands of storytellers that we coordinate with around the country. And you have people who have, made the decision that they like this family. They've made the decision that they want to be a small business, or maybe it's a single mom that wants to have a small business, and then all of a sudden the healthcare costs are so high. The premium costs are so high. They have to make the decision to shutter their business and go out and see if they can find a job that has employer sponsored health care. That is just an extraordinary public policy decision for Donald Trump and Republicans to make. But they made it because this is who they are. They've never really believed. Republicans have largely never believed in government having a role in helping people access health care, and now they have a real priority of making sure that corporations and wealthy individuals get tax cuts, and they'll just say, well, that are all it's back to the old trickle down idea. Well, 1,000 flowers will bloom, but they're not blooming. They're not blooming for this for this family that Joe knows from Northeast Wisconsin.
And their choice is just one path, right? They're making that choice about dad's going to take the risk, and then we're going to be at the try to stay at this budget level. Other families, they're making the choice. We can't afford to take that risk.
Right.
That means they have less money that they're putting back into the economy, right? It means they're missing out on going to that restaurant that opened up downtown. It means they're not going to be able to drive across the state or go up north camping and rent an Airbnb for the weekend and give the kids a little bit of that, true taste of northern Wisconsin, because they just don't have the money. And the money they do have to spend on that stuff, even that's not going as far as it used to, with the cost of gas and everything. And so it is one part of a cascading series of failures on the economy that has left people feeling pissed off. And they have every right to be pissed off, because if they voted for Trump, this is not what they were voting for, right? There's a lot of folks across Wisconsin, good, hardworking folks who were like, you know what? The pandemic was tough, but boy, before that economy was cooking. I would like to live in that economy again. And we can't expect everybody to understand that Donald Trump didn't create that economy, right? He benefited from the work of his predecessor. But what we are seeing now is every week, every day, you've got folks who want to support Donald Trump and have supported him in the past. And they go, what the hell is this? This is not what we thought we were getting. And so that is creating, I think a lot of atmospherics where pissed off people are going to demand change this fall. And that is really important. And healthcare is central to it.
Yep.
Accountability. I think it's a real opportunity for accountability, because, honestly, do you think, either of you, that the lawmakers who voted for this, the Glenn Grothmans, the Tony Weeds, do you think they really knew how much they were hurting their neighbors and their constituents? Or do you think they just don't actually care?
I'm not sure. I try to give people the benefit of the doubt. And I think one of the challenges that our friends on the Republican side of the aisle have in this moment is they have been captured by an information machine where they believe the very propaganda that, that permeates the world in which they live.
This is very kind of you. This is a
I-
very generous take.
But I think it's right, because it does not make any sense to be this damn cruel. It does not make any sense. I'm trying not to jump to Tony Weed, for example. It must be a moron or something, because he thinks that there's healthy 26, 27-year-olds sitting in their mom's basement getting checks from Medicaid. That's preposterous, because that's not how Medicaid works. So it's clearly that he doesn't understand it, which means he's being piped the same propaganda that has misled millions of Americans. And now it is a cycle of self-destruction, because Tony Weed should know better, but he clearly doesn't.
I mean, when I went to Washington, D.C. to go help him understand better, he was not interested in listening. So as generous as you are with your take, I would add, like, it is your obligation as an elected leader to listen to experts and to listen to your constituents. And I don't think there's a lot of listening going on. There really haven't been any Republican town halls since these folks were elected a year and a half ago. I don't know that they've been listening outside of anything other than the rabbit hole that they live in.
Yeah, I will definitely take the less generous view here. I really believe that they don't care, and I think some of it is that they have been subject to their own disinformation. I think that is part of it. I think that they will follow Donald Trump off the highest cliff in the world. They'll follow him off Mount Everest if that's what it takes to curry his favor and not get targeted in a primary. But I mean, this Republican antipathy towards government having a role in securing health care for the American people preceded Donald Trump. I mean, just go back to the debate over the passage of the Affordable Care Act. I think you could probably go to the debate over the passage of Medicare and Medicaid. You could go to the debate over the Clinton effort to pass
Teddy Roosevelt, keep going.
Yeah, go back and back and back, and you'll just see Republicans feel like that there's personal responsibility and that people should, I mean, look, they hand out a lot of money to the wealthiest corporations. They hand out some of the biggest tax breaks ever to oil companies who are just flourishing, especially now, and for some reason they don't have to rely on personal or corporate responsibility, but everybody else down the line, individuals, families, small businesses, you have a personal responsibility to take care of your own health care, and that was the view of George W. Bush. It was the view of Republicans in Congress when we tried to pass the Affordable Care Act. I think it's their view now, except it's accelerated by the sheer meanness of Donald Trump. So Donald Trump gives them cover to not care.
Well, how do you take personal responsibility when premiums are just like simply unaffordable? In the report, there is a 60-year-old couple in Wisconsin, for example, making $85,000 a year. They are solidly working class, and now they're paying over $31,000 a year for health insurance premiums, just for the premiums, not even for the deductible, not even for the care itself. That's more than most people's mortgages. Who are these people? Who are we actually talking about here?
Well, you really are talking about, I mean, look, we're talking about people who are working class. We're talking about people who are in the small business economy. We just released a report last week about gig workers. And so you're talking about, people that really can only buy insurance on their own. This includes this whole new industry of creators and online influencers. It includes delivery drivers. It includes all types of your traditional small and independent businesses, and they're really struggling to afford health care. And so what you're seeing is a lot of people decided not to sign up, just full stop. They didn't purchase the plan, and then others were more or less, in some cases, are auto enrolled, and then they get that first premium notice, and they're like, "Fuck this, I'll take a chance because I can't afford it." I mean, here you're talking about, in that situation, nearly 37% of that couple's annual income is going to healthcare premiums
before taxes.
That's before they pay their mortgage. Or their rent, or their utility bill, or God forbid, go on go on a vacation. So there's a real, and it doesn't have to be this way. I mean, look, I will concede that if we were starting from scratch, if I could go back to the beginning of the Republic, I would write healthcare as a right into the Constitution, and then from there, government would figure out how to make sure that that right is supported. But we can't go back to the beginning. So we have this patchwork. We have Medicare, we have Medicaid, we have TRICARE, we have the Affordable Care Act, we have employer-sponsored insurance. We have all of these things. I'll tell you what the hell we had when Joe Biden left office. And people can criticize him all they want. When Joe Biden left office, we had the lowest uninsured rate this country had ever seen.
That's
we had
exactly
more
right.
more people with health care insurance, the lowest percentage of people without health care insurance in this nation's history. And Donald Trump came in and snapped his fucking fingers and turned that around on his dime. And now we have uninsured rate rising, we have costs rising, and all it was in service of his ability to give tax cuts to billionaires.
And not only did they have insurance, they had insurance that they could afford and they could access health care. And this is another huge problem because I don't think people really realize the impact that these funding changes is having on hospitals. And the report details 8 Wisconsin hospitals and clinics that are either already closed, cutting services, or at risk. We've seen these reports for all over the country. Rural hospitals in particular are being impacted here. When a rural hospital closes, what happens to the people who live in those communities?
How do you take personal responsibility when you're 2.5 hours drive, you live in north of Highway 29 and you're in a healthcare desert?
Right.
How far do you expect, your granddaughter to go who's in her mid to late 20s, starting a family? You're so excited to be a grandparent. And you know better than anybody, Doc. Like
I do.
The maternal care deserts are extraordinary. And so we're now caught in this like vicious cycle where there is less access. Costs are going up. People are losing care. And what happens? Well, people still get sick. People still have accidents. People still need health care. But then when they go to get it, they are getting it at the most expensive rate there is in an emergency room, if they can make it there.
Right.
Well, those hospitals, and health, they're not going to eat that, right? So they're passing those costs right back to the people who do have insurance. Like, this is madness. And so, again, it's this, like, cascading. It's not as straightforward as, well, Jeff Bezos got a tax cut, and if you get a little in-home support because you're, on Medicaid, because you have an assistive mobility device, and you need a little support for an hour or two a day, so Bezos wins and that person loses? No, it's affecting every single one of us.
Yeah, I think that's the untold story here. That's the untold story here. It's people not getting health care, going to the emergency room. Uncompensated care is increasing the premiums for people who buy health care on their own or are in the employer market. So
Right.
you'll see the cost to people who lost the tax credits more than doubling in terms of premiums. But then people on employer-sponsored health care are seeing their premiums rise 10, 15, 20% because the insurance companies are making up for what they're losing from the lack of the tax credits and the risk pool changes. And I mean, the whole thing. And what happens is states are picking up costs, hospitals are picking up costs, other people in insurance plans are picking up costs, and the federal government got off the hook for those expenditures so they could provide a tax cut to the richest Americans.
But wait. Rural health transformation grants. There are robot ultrasounds in Alabama. I mean, that's great, right?
Yeah, I just stunned that anybody could buy this. And they're so full of their own disinformation. They run around and they say, never before have we invested $50 billion into rural health care. Well, that's not true. That's not true. We were investing a lot more than that until you cut $1 trillion out of Medicaid. And the thing is, Doctor, that we know that this is just starting on the Medicaid side.
Right.
Because
we haven't even felt it yet.
We haven't even really, there are a lot of there are a lot of hospitals and clinics that are making decisions now because they see what's happening down the road. So they're tightening their belt by getting rid of a low performing, like maternity care, maybe low performing. I don't know. ER might be low performing. So they're cutting some services, some are closing. But man, when these cuts really hit at the beginning of next year, and then the word that Joe keeps using, the cascade in the future years. I mean, we're going to go from, we're tracking almost 1,000 clinics, hospitals, providers who have announced some type of closing or cut or at risk of closing. Now that's going to explode when these cuts really start to take place. So these people are going to be driving farther. They're going to be sicker. They're going to be, they're going to have uncompensated care at faraway places. And some people are just going to get sick and die because they're not going to be able to afford to get the care they need.
I want to go a little bit deeper on one, for instance, because Brad's exactly right. These mega corporations, Optum Health is just one of them. Mm-hmm. They see that writing on the wall and they go, shit, we can't survive this because mental health, the largest payer of mental health in the country is the United States government through Medicaid. So they start shuttering clinics, dozens of them across the country. Here in southeast Wisconsin, where I am, 2 of them got closed. Red Oaks facilities owned by Optum Health, one in Waukesha, one in downtown Milwaukee. Well, I don't need to tell either of you, it is hard enough to get mental health care in this country. Mm-hmm. The demand far outpaces the supply, and now the supply is going away. And it's not just limited to, if you're in northern Wisconsin, and you choose to live that way, you want to be out in the sticks because you love it. And some of the trade-off, right, is, you live a little further away from health provider, but it's also impacting people in the big city of Milwaukee because there's even less access to care than there was. And so that's what I mean when I say this is impacting everyone. When you look at that heat map of Wisconsin, where these clinics are, yeah, they're right down here in southeast Wisconsin, but they're also in Osseo. They're also, up north of me, but not quite as far north as you in Green Bay.
Two Rivers, Oconto Falls. I mean, yep. There's a whole list of them.
Yeah. And so this is impacting everyone.
Yeah. And I would say, you mentioned where you choose to live, but this is a huge part of it, right? People live in the place where they have support, where they have resources. It is hard to pick up your entire life and move somewhere just because you can't get healthcare in a place, because then you lose all of the other strings that attach you to your community. And, we were talking about the impact on rural communities when a hospital closes. Well, when I work in southwestern Minnesota, the hospital is the biggest employer. The hospital has the cafeteria where it has best food in town, so people go there for lunch. If that hospital closes, that entire town is going to die. And what are the people who live in that community going to do then? And that's just one example. And we haven't even talked about prescription drugs. Can we please talk about what the fallout is with regard to prescription drugs? They haven't gotten cheaper. I think they've gotten more expensive.
They haven't gotten cheaper. I think there's some since he's been in office, Trump's been in office, there's some 686 or so brand name drugs that have increased by a significant percentage. And
but Brad, he made deals. Huh? He made deals with the companies.
He's made deals with these companies, and the thing is that his pollsters are telling him, and they're telling Republicans, okay, you fucked up on Medicaid, you fucked up on the Affordable Care Act, lean into lowering prescription drug prices.
Or at least making it look like you are.
Yeah, or make it look like you are. But it's all bullshit. I mean, first of all, go back to H.R. 1. They held harmless a bunch of drugs that we should be negotiating lower drug prices for through Medicare. They held some of the most important cancer drugs in this country and others that they held harmless. They literally listed them. Said, okay, we're not going to subject them to Medicare drug negotiation. They have made no proposal, for example, to do what Democrats would do if we were in charge, which is to extend the savings that we're getting in Medicare, those negotiated prices, to the rest of the market. And Trump RX is the biggest joke around. I mean, it is just listing drugs that you could find your own coupon on, that you could get cheaper with, get cheaper with a generic. It's just something. It's literally just something for him to point to and say that he's doing something on drugs when all he's doing is cutting deals with Big Pharma. Big Pharma is going to stand with him in the White House and herald, Trump RX or herald this negotiation they've had if it was affecting their bottom line? Of course they wouldn't. Of course they wouldn't. And so we've taken a real step back. We made the greatest progress ever under the last administration in terms of, lowering drug prices. Unfortunately, we had to do this under reconciliation because we couldn't get any Republicans to go along with us. So a lot of the savings were limited to Medicare and to Medicare beneficiaries.
Right.
But we need to extend those things out. And the only way it's going to get done is put Democrats in charge. Republicans are not serious about lowering any healthcare costs. The last of which they're interested in lowering are prescription drug prices.
Yeah, let's acknowledge the report notes that Big Pharma posted a combined $177 billion in profits last year, which was a 65% increase. So while Donald Trump was telling people that he was lowering your prescription drug prices, actually they were going up, and not by a little, 65%.
Yeah, no doubt.
It's crazy.
It is crazy. And look, let me say something about all this. So Joe and I are not in just the bitching and moaning business. Which is
Joe packages it, makes it look real pretty, though, I noticed.
Which is a lot of what we've been doing so far on this. So we really need to make change. And look, we did that. I mean, we made 2018 a healthcare election, 2019 and 2020. Nancy Pelosi and Democrats passed a lot of legislation that languished in the Senate that Mitch McConnell was in charge of and Donald Trump was president. And then, Joe Biden won, and we got some stuff done. We got the premium tax credits in place. We got the lower prescription drug prices through Medicare, and we need to do that again. My biggest fear, and the data is moving in our direction, but my biggest fear is that people are pissed off about everything, and they're pissed off at everybody, every company, and every institution, and that they might just see higher prescription drug prices or the rural hospital closing or higher premiums for them, and they might just think, fuck it, it's them, it's the insurance companies, it's the pharmaceutical companies. But they need to pin the blame where it belongs, because this is not going to get fixed unless Democrats are in charge. And unless Democrats can get back in charge in a sufficient enough way to restore, we need to do three things if we had a trifecta. Before we can do other things to improve healthcare, we need to restore the tax credits, because they can immediately help millions of people who are losing coverage afford coverage again.
Yes.
We need to restore 100% of the Medicaid cuts. So more or less, we need to repeal all of the Medicaid provisions from HR 1. We need to restore all of that, because otherwise it is going to cascade badly so quickly when those cuts start that it'll almost be unrecoverable at that point. And then we need to do everything we can to lower prescription drug prices. If we do those three things, and I think one of two things got to happen. They've got to get beaten so badly as a result of healthcare in the next few elections that they come around and they say, you know what, healthcare might be something we could do on a bipartisan basis.
Right.
Or we just have to get a big enough majority of Democrats to be able to pass these things. And once you get those three things done, and the prescription drugs might be just incremental, a little bit more drug negotiation, extend that to the commercial market. But the big things, the things that will reverse the harm most immediately, are stopping what they broke, or you're fixing what they broke. So, restoring the tax credits, restoring the Medicaid cuts. And then after that, you can look at other things. I mean, you can look at consolidation and look at hospitals, and you can look at PBMs, and you can look at other ways to extend coverage. I mean, like Nancy Pelosi tell you, her biggest regret from passing the Affordable Care Act was it didn't have a public option that could compete with insurance companies. And so
Amen.
that would be an option. That would be an option down the line. But we're Joe and I are not just bitching and moaning. We're producing this report and publishing this report because we want the American people to know where the blame lies, and then they can hopefully act appropriately in November.
And I think the word's getting across. We point out in the report that Wisconsin Manufacturers and Commerce, which is a traditionally very conservative, very right-leaning organization. They pay for all kinds of those terrible TV ads that you see come election time, and they're never on behalf of the Democrat, right? But that WMC stated in their last, survey, this top policy priority of their members, making healthcare more affordable.
Yeah.
They get it, right? Like, they understand that this is not working. It's bad for business, it's bad for families, it's bad for individuals. And so what's the first part of addressing a problem? Admitting you have one. And so I take that as a sign of optimism that they recognize they have a problem. And every day that more people with more influence on the right awaken to that reality, the more likely it is we can do what Brad is talking about.
Well, the reality is in their own households. I mean, the report itself says 90% of Wisconsin voters are at least somewhat concerned about health insurance, and 63% are very concerned. You can't deny that. And that cuts across all parties. No matter where you vote or who you vote for, you're worried about health care because you can't get it. You just can't get it right now. So that does not surprise me at all. Although you're right. I mean, they typically are quite a polarized organization. So maybe that is a harbinger for things to come in the midterms.
Let's hope so.
Brad, Protect Our Care has been sounding the alarm on this for a long time. So what do you need from ordinary Wisconsinites? Not politicians, not advocates, not people like us, but regular people to turn this around. How do regular people, somebody who's listening to this right now, what can they do to help fix this problem?
Well, I mean, right now, I would say that they've got to be engaged in the political process. They need, if they're concerned about this, they need to talk about it. They need to, look, I confront Republicans about it, find out why they haven't presented a plan. Go to, if there are any town hall meetings, go to town hall meetings. But I would say that they have to be supremely politically engaged. We are in the throes of an election. I mean, I know people don't think about it that way, and we're kind of in the business, so we do think about it. But we're just a few months away from what is, I'm not going to say it's the most important election in our lifetime, because people say that all the time. But this is a really important election to set the direction, to say that all of these policies that Trump and Republicans have pursued. I mean, these are the people that said that they would end inflation on day one, that they had a plan for healthcare. Everything they've done, from the tariffs to the war to HR1, has reversed all the progress that we had made coming out of the pandemic. I mean, it's been the biggest kind of self-own, although they don't seem to really care. But they have, this has been this has really hurt them politically, but they somehow just can't grasp it. I would say you just got to be, and that means being active everywhere, wherever you are, whether you're on Facebook or Instagram or on X or on Blue Sky or on Threads or wherever else, and in your community around the water cooler, the whole of what you can do to affect and tell your stories. That's the other thing. Yes. Is that we have thousands of healthcare stories, but there are literally millions of healthcare stories in this country, and there are thousands and hundreds of thousands of healthcare stories in Wisconsin. So, put those out on social media, lift those up, write a letter to the editor, go old school here, and get those stories out. If your healthcare has been negatively affected by HR1, by the Medicaid cuts, if you lost the ACA tax credits, if your rural hospital is shuttering, part of itself, its maternity ward or its emergency room, or it's closing altogether, speak out and do it now.
Joe?
The only thing I would add to that is go as old school lo-fi as you need to. Not everybody is on social media. I was talking to some folks last week. We're talking about bringing back chain letters. I swear to God.
I love it.
Because so many people have just tuned off those stupid phones and the social media that they know is like bad for them. Sit down, write a letter, make 10 copies of it, and send it to 10 people you know. Ask them to do the same. I guarantee you're going to change minds, and people are going to be like, hey, I got a letter from my friend. That, right? Like, everybody reads personally addressed mail. How much of the stuff that you get in your email or your social media do you really open up and read all of it? Come on, right? So there is no wrong way to do this, but it is more important than ever that you do it, that you use your voice, because the only way to combat disinformation is with information.
Yeah.
And that's, what we all have to do.
I think the key here, do something.
Do something.
Do
That's right.
something.
We're so conflict averse. And, even if you're like having a conversation with somebody at a diner or at school when you're ready to pick your kids up, it's okay to talk about this. You don't have to talk. You don't have to lead with, I'm a Democrat and I want you to know. Lead with, I'm really struggling because I can't get an appointment for my son who's having a mental health crisis. Lead with, my healthcare expenses are so expensive that I don't think that I can continue putting my kid in daycare, which is a whole other conversation. Talk about the problems, because it will soon become very obvious how when we come together, we can solve these problems.
Yeah. I'll tell you the other thing. We got the 4th of July coming up, and it is patriotic as hell to be passionate about making sure that people in this great country can afford the care that they need. I mean, that's right. Like, this is the greatest country in the world. It ain't perfect, right? But that's part of why it's great, is because we're always striving to make it better. And if this generation doesn't demand that we put a stop to, not just the choice to make it worse, but address these patchwork fixes that we have, then we're not worthy of inheriting the progress that previous generations made, right? And so, that's how's that for a conversation starter at your barbecue this 4th of July? What the hell are we going to do about healthcare, right?
I'm looking for my flag. I wanted to wave my flag there.
Yeah.
I mean, that was perfect.
That was well said, Joe. Well said. I do think that people, look, that there's so many things that people are worried about. And we hear it all the time. People are worried about the future of democracy. They're worried about authoritarianism, fascism. They're worried about, climate. They're worried about the local economy. Man, I'm going to tell you something. And you know this, Dr. Lyerly, because you are with patients all the time. If you don't have health, nothing else matters.
That's right.
If you don't have good health care, if you're not in good health, nothing else matters. If you're sick and you can't afford to get your cancer treatment, you're not thinking about the future of democracy. You're thinking about, how am I going to afford that cancer treatment? And so we got to get health care right. And by the way, just speaking from a partisan lens, if we use health care the right way, it's a big political advantage to Democrats right now. We got a big trust advantage on it. If we use it the right way, we'll be back in charge, and you know what? That'll help protect democracy.
It sure will.
That'll go a long way.
Speaking from a doctor perspective, I don't know if you guys saw the study that came out in Nature a couple weeks ago that showed that conservatives are actually less healthy and die younger than liberals. And there are a couple reasons why people who tend to be less healthy tend to move over to the conservative side, but a big part of it is undermining trust in healthcare. Yeah. So, if you think politics and healthcare are not related, think again.
You're absolutely right.
Yeah. Well, guys, thanks for hanging out today and talking about this crazy manufactured crisis that we are dealing with right now, and all the people who are affected because they can't access, they can't afford, they just can't get healthcare. How can people get in touch with each of you if they want to know more?
Well, protectourcare.org.
Yeah.
You can find us there. You can find us on Facebook at Protect Our Care Wisconsin. We would love to hear from you. We're always talking to folks. We're always doing events to lift up people's stories and make that change possible. So, no pressure if you reach out to us and you don't want to have the camera in front of you. That's okay. We'll find another way to help you tell your story, because we believe it is critically important that people who are living this challenge tell others about it, right? It's one thing for those of us who are at the moment blessed with good health and good coverage to talk about it. It's another thing if you are directly impacted because you do get a little support from Medicaid, or you're struggling to make ends meet because you lost that ACA tax credit, or your prescription drug costs increase. If that is your reality, we want to hear from you.
Absolutely. So I was going to say protectourcare.org, and of course Joe Zepecki. Just find Joe. He'll set you straight. But Defend America Action, which wrote this report with the support of Protect Our Care, been out there, been around a little over a year, and really focused on not just healthcare as Protect Our Care is, but really focused on lifting up the affordability crisis in this country that has been spawned by Donald Trump, been spawned by Donald Trump. Every bit of it started with the tariffs, which were found to be illegal. He's continuing with these tariffs that are terrible. He's trying to defy the courts that have said that a bunch of them are illegal. Then then it was HR1 and what he did to food assistance, what he did to health care, and then you fast forward in this damn war. This war that has been a complete, utter failure. But the only thing it has succeeded in is raising gas prices on the American people. And those prices, as Joe would say, they're cascading throughout every sector of the economy, including the farm economy and grocery prices and everything else. So Defend America Action very much focused on this affordability crisis and pinning it where it belongs, Donald effing Trump.
Defend America Action, protect our care. Everybody watching, if you have a story to tell, if this made you angry, that's good. You should be angry. Do something with it. Tell your story, share this episode, talk to your neighbors, show up, because the only way that we fix this is if enough of us decide that we're not going to let them get away with it. So my thanks again to Brad Woodhouse and Joe Zepecki for joining me today. I'm Dr. Kristen Lyerly. Thank you for watching.